Fasting in Ramadan is a medical challenge for both patients and healthcare providers. So if starting off with patients, the health implications of fasting for diabetics, we run into a few risks. One of them is related to their change in their eating habits. So we're looking into variation in their blood sugar ranges between hypoglycemia and hyperglycemia. We run into complications related to decreased oral fluid intake, which lead to dehydration and its complications, including increased risk of thrombosis and increased risk of chronic kidney problems, especially for people with baseline kidney problems and people on blood pressure medications. For type 1 specifically, we run into complications related to DKA or diabetic ketoacidosis. Challenges that are facing healthcare providers include lacking of experience and resources to help their patients who insist on fasting to do so safely. And we have a problem with the patient trusting the health or the available healthcare system to offer support and help during Ramadan. So patients tend to do it on their own, relying on their previous experiences because they are aware of that gap at the healthcare providers level, and they hate to be discouraged from fasting by their healthcare providers. St. Joe's Primary Care Diabetes Support Program is offering a safe, trusting, supportive environment for Muslim diabetics during Ramadan. So patients can trust us with their previous experiences and with their intention to fast or not. Our job is not to advise patients to fast or not to fast. Our job is to do a full risk assessment and make the patient aware of their risk categories so they can make an informed decision about their fasting in Ramadan. And regardless of the patient's decision, regardless of their risk category, if they are insisting on fasting, we will support them during that journey to do it as safely as possible. Our program offers in-clinic visits for diet counseling, exercise counseling, and medication adjustment to match the lifestyle changes in Ramadan. We also offer remote support via email or phone calls to keep patients on track and deal with their concerns or any complications as they arise in timely manner. Now, we ask the patients to test their blood sugar more frequently during Ramadan. The intensity of the support and the frequency of the monitoring and even the phone calls, emails, and in-clinic visits depends on the risk category of the patient. Patients at higher risk, we support them very closely to do it as safely as possible. If you want to fast safely, simply call us at St. Joe's Family Medical Center. You do not need referrals. رمضان كريم لكل المسلمين في كندا وفي العالم. سان جوز تعلن عن توفر خدمة المتابعة الصحية والرعاية لمرضى السكري في لندن خلال شهر رمضان لمن أراد منهم أن يتم فريضة الصيام. لا تحتاج إلى تحويل من طبيب العائلة. كل ما عليك فعله هو الاتصال بالعيادة على الأرقام المرفقة في الويب سايت.